Hi, I'm Melissa, a nurse injector at Cynthia Gregg, MD, Face and Body Specialist. And this video is educating you on Quo, an FDA-approved injectable treatment for cellulite. All three of the nurses here are CANS certified and all inject Quo, but I'll be educating you on the procedure in this video.
So what is Quo? Quo is the first and only FDA-approved injectable available that treats cellulite in the buttock of adult women. Quo is non-surgical, Quo is an injectable, and Quo works in 3 ways. One of the ways is releasing fibrous bands, redistributing fat cells in the buttock, and stimulating the growth of new collagen. Quo works by breaking down the buildup of collagen in these fibrous bands that cause cellulite. But what exactly is cellulite? Cellulite is actually not your fault. It's just a natural part of women's biology. Most women will have cellulite in their lifetime, about 9 out of 10 women in fact. That means your tough workouts and healthy eating habits are fantastic for your fitness and overall wellness, but won't do much to reduce your cellulite. If you really want to reduce cellulite, you need to understand what's behind it. Cellulite is not fat. It isn't caused by what or how much you eat, or because you aren't exercising enough. Here's what causes cellulite. Let's look under the surface of the skin. Over time, skin thins. Fat cells enlarge and push against the skin. Fibrous bands under the skin thicken and cause tension and the signature dimpling in the butt. If you're a candidate for Quo, at your appointment, your nurse will discuss treatment and expectations. After identifying the treatment area, markings will be placed on the area and baseline photos will be taken. They will then use a small needle to inject Quo. Quo injections take 10 minutes or less with minimal discomfort. The side effects that can happen after Quo is visible bruising for 2 weeks or longer. This is something that needs to be stated to patients who are preparing to have a Quo treatment. The bruising is not based on pain or trauma, but rather the same molecule that breaks down the little collagen dimples can also break down the vessel walls adjacent to the dimple, thereby causing bruising. This bruising will go away. However, we like to tell patients not to schedule a Quo treatment if you cannot be bruised on the buttock for 2 weeks. Treatments have to be spaced 21 days apart, and we require 2 treatments minimum, sometimes needing a third. It's important to space 21 days apart so the collagen septi, the little bands, don't bind back together. There's a 3-day grace period before or after the 21 days. We will have you make both appointments prior to coming in for your Quo session to ensure that both treatments can be made. Here are some before and after photos of patients who have received Quo. Patients have reported seeing results in as little as 10 days after their first treatment. We are thrilled to offer this procedure to our patients at Cynthia Gregg, MD, Face and Body Specialist. Call today for a consultation to see if you're a good candidate for this procedure.